In this case, we will show you how to implant a dual chamber ICD. We will start by implanting the Invictus ICD lead. We acquired access through an axillary approach, as shown in another video. Looping through the tricuspid valve is considered the safest approach. We attempt to place the ICD lead on the mid-RV septum. An LAO view will enable to verify a septal position. Curving the distal stylet enables better positioning of the ICD lead perpendicular on the septum. The screwdriver tool is used to extend the helix under anteroposterior fluoroscopic guidance. Respecting the lead trajectory and under minor pressure. The stylet is partially retracted in order to expose the lead's final position and the movement. This lead properly senses the ventricular rhythm at around 14 mV. Note that the patient is currently in atrial fibrillation. There is presence of an injury current and the EGM looks stable. The impedance is around 900 ohms. The 12-lead ECG confirms RV septal capture at 5 volts. There is also capture at 2 volts. Capture is lost at 0.7 volts. So the threshold is 0.8 volts. Now we will implant a Vega microport lead into the right atrium. Once in the right atrium, we change the straight stylet for J-curved stylet. This allows us to advance the lead tip into the right atrial appendage. We will not be able to see the classic windscreen wiper movement